So Secretary Burwell, let's start with the big news. You got $1.1 billion in Zika funding. Congress finally got around to passing funding for the Zika bill.
I'm very excited.
So I guess the first question is it enough? I mean, you guys had said for a long time that $1.9 billion was absolutely essential to deal with this. Is it enough?
You know, we're happy to have the money that we have. The additional money, we asked for it because it was important. Part of that money would go towards replacing the money we had to take from Ebola, which actually still is something we have to watch in West Africa. But right now what we're excited to do is take this money and continue moving forward on making sure that here in the United States we're as prepared as we can be, helping states like Florida who have local transmission. That means the mosquito is actually biting people. Over 100 people have contracted the disease in Florida, making sure that we are working on a vaccine, which we think is the most promising solution, and we are making progress. We have one vaccine already in phase 1 trials. This week we announced work with corporate partner Sanofi. We're another vaccine because it'll take several probably to get it. And the third thing is making sure we're really working on diagnostics. And finally, this money will really help us with the research. There are a lot of unanswered questions about Zika. In other words, if as a pregnant woman, if you get it in the 3rd trimester, does it still cause the damage? And the other thing is, while we know microcephaly, it's clear it causes that, we still do not know if there's other damage, such as hearing, sight, or developmental issues that may occur for children who don't present with microcephaly when born.
So how far away are we in the best and worst case scenario from getting a Zika vaccine?
So in terms of the best case scenario, probably 18 months in terms of, and that is if all goes well.
Yeah. And I've seen recent reports that are really frightening about transmission, and that the virus is evolving and it may be much more easily transmitted.
So I think the question in terms of the transmission, I think most people don't realize that in the United States, including our territories, which is Puerto Rico mainly, 23,000 cases of Zika.
Wow, already.
Already. And so here in the 50 states, there are over 3,000 cases. And the other thing I think most people don't realize that we've already had 21 births in the 50 states and territories that are children that are born with microcephaly and test positive for Zika. So the negative outcome that we're also fearful about, we're already seeing.
But how dire can it get? I mean, it could get...
You know, I think the question of transmission, it's transmitted 2 ways, through mosquitoes, and those are mosquitoes, 2 different mosquitoes that exist mainly in southern states, but go up as far as, there are some here in Washington in terms of these mosquitoes and how far they go. It's also sexually transmitted, which I think people forget. But I think the issue is, what this is most dangerous for is pregnant women, because 80% of the people aren't symptomatic. Right. And that's actually a problem, because you could go visit one of the 55 countries that actually have outbreaks right now. You come back and you don't know that you have it. And then the question of either you getting bitten by a mosquito or sexually transmitting it unknowingly. And that's why people who travel to these areas really need to be careful for a period when they come back.
I think most people watching Congress go back and forth on this for months and months and months were pretty horrified. You have this crisis, frightening, and Congress unable to provide any resources to deal with it. Did that delay cause harm? Did that set you back in this effort?
No, a number of things it did. We had to make decisions that I think were not what I would like to make as far as decisions. The first was to take money from Ebola. I think most people don't realize we've actually, within the last 2 months, had to send a team from our Center for Disease Control and Prevention back to West Africa to make sure that we weren't going to have additional outbreaks. And so that taking care of Ebola is quite important. The second thing that we had to do, and I had to do this in August because we expected it would be passed before and it wasn't, I had to take money from the rest of the department and take money from things like cancer research in order to keep the efforts going. Because at this point, there is local transmission in Florida. We need to be able to provide the help. We have teams right now in Florida that are teams that are helping Florida determine the cases, the number of cases, assist Florida in fighting the mosquito, and those are things that we couldn't stop.
So in hindsight, did the administration, did the White House make a mistake in not accepting the $1.1 billion that the Senate passed? months ago?
You
When
know,
you had an opportunity to...
With regard to emergencies and that question, that was not a Zika supplemental. That was a Zika supplemental that had additional pieces and parts that were harmful to the issues, and especially in this particular case, as you can imagine, because it's sexually transmitted and because this is about pregnancy and women, contraception is important. And that was a lot of that conversation. I think we're pleased we are where we are now, and we have been working to be ready to spend this money effectively and efficiently.
Okay, so the Affordable Care Act, this is your crunch time. This is open enrollment, getting ready to start. What's your goal? What are we at right now? How many are in the exchanges, and how many do you expect?
So I think when talking about the goal of the Affordable Care Act,
Yes.
The marketplace is a very important part of it, but the overarching goal is the one that we focus on. And that's creating access, affordability, and quality. And access, the 20 million uninsured, that's the number that we set in our mind, and the marketplace will be a contributor to that.
A big part of that, obviously, is Medicaid expansion, but what do you expect with the exchanges?
So with the exchanges, we're going to go all out this year in our open enrollment 4. Just this week, we had a millennial summit, so that we are focusing on those young people to make sure that they know that affordable care and coverage is available. That's an important group to reach. We are working with partners, new partners, and we're working with more digital partners than we've never ever worked with before. Partners like Lyft, the new economy kinds of partners, to make sure we're reaching people where they are. The other thing we're very focused on is we know that many of the people we want to reach use mobile, and so none of that enlarging the font or things like that. And so working to create a product that people are going to want and make it easy for them to be able to access it.
But you've had some, I mean, it's been a tough year in terms of the exchanges. You saw Aetna pull out, United Healthcare was in, 34 states, and now they're going to be in exchanges in 3 of the states. Humana is reducing, 30% of counties in this country. People that go into the exchanges will be facing a single plan to choose from?
You know, I think, again, this comes to what is the goal of healthcare in our nation. And when we think about healthcare in our nation, 150 million people, and probably most of the people in this audience, have employer-based care. And that's where the vast majority, another huge chunk of people, are in Medicare and Medicaid, tens of millions. In the marketplace, we're pleased with our 11.1 million. But that overall picture, we learned just 2 weeks ago that in that market, premiums and growth in that market, we've seen 5 of the last 6 years have seen the slowest growth in premiums that we've seen in the employer-based market.
In the employer-based market.
So we're very focused on the overall healthcare. With regard to the marketplace specifically, most places have more competition than that. There is reduced competition this year. That's something we want to encourage, more and more competition. That's part of why we're working hard to make sure we're attracting the people. We're working hard to respond to the insurance companies' concerns about the marketplace and go in together with them on how we make sure we reach more people. And I think the other thing is a number of players have actually expanded in the marketplace. In Arizona last week, there were questions about a county. The company that went in actually in their press release said, we look forward to how this will add to our profitability. It's a new market. Different players are having different success. And what we want to do is work to make sure it's a place where as many as possible can do that. But they are learning, and it is a transition year.
But certainly, and I covered the passage of the Affordable Care Act in Congress. I fully understand that there's a lot more than just the marketplaces. But one of the big goals here was to slow the growth of healthcare costs. And in the marketplaces anyway, it looks like it seems like it's a failure. You've got premium increases estimated at 11% for this upcoming year. And that's if you're willing to shop and switch your plan, you're kind of a best case scenario? So
I think, again, thinking about the overall and what's happening, for those 150 million people, we've had slower growth. And we don't want growth at all. And we need to work to continue to put downward pressure. But for that 150 million, slower growth. In Medicare spending has been $473 billion, with a B, dollars lower. And in the marketplace itself, if the insurers had priced at the level that CBO suggested and did all their estimates on, it was 15% higher. So in the marketplace initially, insurers basically underpriced for the market that they were trying to serve. And that's not a criticism, they didn't have data, they didn't have information. But if you follow the line of where CBO, the basic growth from the CBO premium to where we are now, you're about at the same point. And so we probably wouldn't have this conversation if it had started higher at the beginning.
So you're not, I mean, are you concerned about the possibility of the so-called death spiral? I mean, CBO's estimates also had a much higher target in terms of people in the marketplace, a higher target for the percentage that would be younger people.
So with regard to that, one of the things, and this is one of the things about the Affordable Care Act, CBO's estimates were based on the fact that you would see a large group of employer-based people coming to the marketplace. I mean,
because the employers will be cutting their
and that we haven't seen. I mean, there are a number of things we haven't seen. I think you know.
Yep.
The first year, the first thing was unemployment.
We haven't seen a lot of death panels, for instance.
No, we haven't seen that. We didn't see a lot of death panels. We did not see our unemployment rate go up in the nation. As a matter of fact, we saw it go down. That was the first thing.
Sure.
The second thing was we're going to see employers, what they said, dump into the marketplace. And that's what caused those CBO numbers to be what they were. Mm-hmm. That didn't happen. The third thing that everyone said we were going to see is everybody was going to increase their part-time employees dramatically in order to avoid, to get below the numbers. And those are all things that we haven't. But I will say, confident in the marketplace, but know that we have many things to do to make it better and make it stronger. And so what we want is a year where next year where there is more competition coming in. We think it is a transition year with regard to that pricing based on what happened before. And so we know we have work to do, but I think the basic of your question, are we confident? Yes.
Okay, that leads me to my next question. We have an election going on. You probably have seen this. You've been busy. But what happens to the Affordable Care Act in the event of a Donald Trump presidency with a Republican Congress?
So
I've seen reports, by the way, that you are working on Trump-proofing the Affordable Care Act. Is this true? You know, doing things to make sure that it can survive even?
So one of the constraints and requirements I face is something called the Hatch Act. And so my ability to talk about elections, candidates in any way, shape, or form in my official role won't do. But let me
Does that
answer
disappoint you,
your
by
question.
the way, having that
Let
restraint?
Let me answer the question in a form that I can, which is about the future of the Affordable Care Act in any scenario. And I think the question you're asking is, can there be repeal? Can we go back? And the fundamental of this is in the fabric of our nation. And what do I mean by that? I think most people, if we asked everybody, and we just did it by phone and asked everybody, do you want pre-existing conditions to be able to keep you out of your health care, whether it's your family member? Do you know somebody who's had cancer, asthma, anything? And do you want to go back to a world where that can keep you out? I don't think people do. For the 20 million people who are now insured, I don't think we're going back in terms of having those people once again become uninsured. For the seniors who were suffering from something called the donut hole, what had to do with their drug payments, there were 11 million of them that have saved $23 billion. I don't think people want to go back. And I don't think people want to go back to a world where you could have annual limits in your health care. I met a woman who delayed her chemotherapy before the Affordable Care Act because she'd hit her annual limit. There are so many pieces and parts that I think many people don't realize is a benefit. And so it's in the fabric at this point.
But walk me through that, because as you've probably also noticed, Congress a time or two has voted to repeal the Affordable Care Act.
I think we're over 40.
So if you have a Republican Congress again, and you had a Republican president who has campaigned on repealing the Affordable Care Act, willing to sign, if they sign it for the 40 whatever number time, I mean, how do you prevent that? I mean,
I think
you think it's just not possible, or I mean, what?
What I think is when something becomes something that could be a reality, and let's look back at a time that I'm not exactly excited to reflect on, but King versus Burwell, when there was a court case that we felt confident about, but obviously it was a court case. And so what happened at that point in time when people thought, oh my, this actually could happen, and the damage that it could cause? What you're saying about the votes.
But those were 9 justices.
But the votes, I think everyone knows in the House,
right,
which is where these votes have occurred, that the president's going to veto it. Mm-hmm. When you're faced with the reality, every district in the country has lowered their rate of uninsured.
So you think Republicans would blink if there were a Republican president willing to sign repeal, that Republicans would not go forward and fully repeal it again?
So I'm not going to get into politics, but what I am going to get into
seems to be what you're
is
saying.
what is the point of view of the American people. And you can translate that, you're much more experienced than I am in translating that to the politics. But what I will say, I believe that the American people will demand that the benefits and the changes and the advancements, we didn't even mention preventative care. So when I take our 6 and our 8-year-old in for their annual visits, there's no additional payment. This is because we want a system that encourages preventive care. Going back from those things, I just think the nation will demand that that's not the place we're going to be.
Can I also ask you another story that has dominated in recent months is this whole controversy surrounding the EpiPen, you know, going from $100 to over $600. What happened there, and are you satisfied that issue has been resolved? I mean, Mylan has said they're increasing their discounts, et cetera. But I mean, watching from afar, again, you see this product, you know, company gaining a monopoly and then profiting off, you know, kids who have, you know, could be depending on this to save their lives.
So access to drugs and affordable access to drugs is one that we think is a priority when I talked about affordability, access, and quality. And we need to take steps as a nation to make sure that we do that. And one of the tools that I think would be most important that we've asked for, but does require legislation, is the ability for HHS to actually negotiate on high cost and specialty, not all drugs, but just to negotiate in that space so we can use tools. We use the tools we have. Right now, last year, FDA approved more generic drugs than it had in the history of FDA. Right now, you know, FDA works to help people understand how to work through the generic process. You can get faster approvals if you are the first-time generic. We use the tools we have, but one of the most important tools that we could gain is an ability to negotiate, because that we don't have right now.
Would that have helped in this case?
Certainly, these drugs are being paid for by Medicaid or Medicare in certain cases, and so that's where we would have ability.
Okay, and then we only have a couple minutes left. I want to give you a chance. I mean, you've got this incredible job. It's one of the most complicated jobs in the federal government, and I imagine you spend a fair amount of your time thinking about the future of healthcare, and there's so much exciting happening outside of the law and all of that in terms of treatment, in terms of technology. What has most kind of got you excited right now about where we're going?
What has me most excited is I believe we are really on a path to putting the consumer at the center of their care. And that is both in prevention and treatment and how we provide that. And that's everything from how the system works, so that your physicians are coordinating their care with your physical therapist, with others, as we think about that care, to the use of prevention, to changing how we pay. So we don't pay for a fee for a service, that your doctor isn't paid for a test, your doctor's paid for your wellness, your outcome, to the precision medicine work that we're doing.
How does that work? I mean, I hear it's outcomes based, so what, you pay more if you're healthier?
So how it works is that instead of being paid, I'll give you the specific example, and now we have put out mandatory bundles, or what they're called. And think about your hip and knee replacement. Your mom goes in for her hip and knee replacement. Today, the way it works is the person who goes to her house and says, take down your dishes, take up this rug, is paid for her services. They're paid. The anesthesia is paid for his anesthesiologist, the surgeon, the physical therapist. But what we are doing is, in order to get them to work together for a single outcome, we, Medicare, will pay for the episode, the 90 days, from the point that person visits to her days of physical therapy. And what it means is you pay for the outcome. So you and the team of providers you work with will be paid for a quality outcome. In the United States, the variation in cost in hip and knee replacements and quality outcomes is great. And so this is how we get to a place where we pay for those outcomes and that quality.
Okay, unfortunately, we are out of time, but much more to talk to you. Thank you very much, Secretary Burwell.
Thanks. Thank you.